Hello friends, today we will start with cannabis abuse. So the cannabis, it is also known as marijuana. It is available in different preparations, that is bong, ganja, hashish. Hashish is also known as charas. So it will cause, cannabis will cause red eye, then increased appetite and also dry mouth. So it also causes a flash back phenomenon, then a motivational syndrome, but running amok. So these are the manifestations of cannabis abuse. Next, we will talk about cocaine abuse. So cocaine abuse will cause Magnan's syndrome. That is, Magnan syndrome is a tactile hallucination of bugs crawling under the skin. Then we will get a black pigmentation of the tongue and the teeth due to cocaine abuse. Then the other names for sorry yeah, the other name for brown sugar or smack is called heroin. Then declarampalt delusion is the delusion of love. Then we will see some of the phobias. The aerophobia is the fear of high places. Then zoo phobia, it is a fear of animals. Xenophobia, it is a fear of strangers. Then algophobia, it is a fear of pain. Then thanatophobia, it is a fear of death. Cytophobia, it is a fear of eating. Then sitaphobia, it is a fear of dogs. Okay, the contamination, it is the most common obsession followed by washing. So the most common obsession is contamination. Okay, then the drug of choice for acute panic attack is benzodiazepines. Then drug of choice for a panic disorders is antidepressants. Then we will see some of the EEG rhythm. First is alpha rhythm. The alpha rhythm frequency is 8 to 13 hertz. In this, the eyes are closed, but the mind is wandering somewhere. That is, the person is awake, but with decreased attention. Then beta rhythm. It is a beta rhythm. It is present when the person is focused on something with a maximum concentration. It is the frequency ranges from 13 to 13, 13 to 30, 30 hertz. Then next comes theta rhythm. Theta rhythm, it is more relaxed than the alpha rhythm. That is a transition from awake to the sleep. So the theta rhythm, the frequency is 6 to 12 hertz. Then delta rhythm. Delta rhythm is present when the person is in a deep sleep. That is a zero point 0.5 to 4 hertz. Okay, who discovered X-ray? W.C. Röntgen. He discovered X-ray in 1895. Then who is the inventor of CD? Godfrey Hounsfield is the inventor of CT. Okay, then in Hounsfield, number for water is 0. Okay, so the ultrasound uses a piezoelectric effect. Then gadolinium. Gadolinium is the most commonly used contrast agent in magnetic resonance imaging. So gadolinium does not crosses the blood-brain barrier. Then the lateral decubitus view, it is the best to detect any minimal pleural effusion. Even 10 to 25 ml of fluid can be detected with the lateral decubitus position. Then X-ray of the left in X-ray, the left dome of the diaphragm, it is a 2.5 centimeter below the right dome of the diaphragm. So in a posterior anterior view of the X-ray, the right margin of the heart, it is formed by the first from above, it is formed by the superior vena cava, then right atrium, then inferior vena cava, inferior vena cava. This is the order from above downward. Okay, at what level the trachea is getting bifurcated? It is bifurcating at the level of a T4 to T5 space. Then what is a Kerley's B line? The Kerley's B line or the transverse line at the lung base. So it is formed due to pulmonary venous congestion that occurs in a left ventricular failure. Then in sarcoidosis, what kind of calcification is seen? That is eggshell calcification is seen in sarcoidosis. Then bat wing edema in a chest X-ray. It is seen in a acute pulmonary edema. Then Rasmussen aneurysm. It is an aneurysm of the pulmonary arteries inside the tubercular cavities. That is called Rasmussen aneurysm. Okay, then we will see about bronchiectasis. For bronchiectasis, the investigation of a choice is a high resolution CT, that is HRCT. Okay, in bronchiectasis, you can see signet ring sign, then a tram track appearance, then a string of pearl and a cluster of grape appearance. So all this CT finding we can see in bronchiectasis. So the most common anterior mediastinal mass is a thymoma. Then we will see about a congenital diaphragmatic hernia. The most common type of congenital diaphragmatic hernia is a Bogdalak hernia. The Bogdalak is the postero-lateral type and it is more common on the left side. Then a Morgagnis hernia. It is an anteromedial type of hernia, also referred to as retrosternal. It is more common on the right side. Okay. So, HRCT, high resolution CT is investigation of choice for a bronchiectasis and the lung disease. CT with IV contrast is the first investigation of choice for a pulmonary embolism. Contrast enhanced CT is also used for lung abscess. Okay, the figure of 3 and double bulging sign, it is a characteristic of coarctation of aorta. Then boot-shaped heart. You can in X-ray boot-shaped heart. Fallet's tetralogy. In X-ray, if you see egg on side heart, that is transfusion of the great arteries. Then egg in cup heart, that is constrictive pericarditis. Then water bottle sign, pericardial effusion. So these are the some fancy names you have to remember. Then a figure of 8 sign in X-ray is seen in a total anomalous pulmonary venous circulation. Okay, then in USC, if you see the target sign, it is suggestive of congenital hypertrophic pyloric stenosis. Then a single bubble sign is seen in congenital hypertrophic pyloric stenosis. You see the single sign bubble sign is seen in pyloric stenosis, double bubble sign is in duodenal atresia, and the triple bubble sign is seen in jejunal atresia. Okay, the multiple bubble sign is seen in ileal atresia, thumb printing sign, that is mucosal edema, it is seen in ischemic colitis, and also lead pipe colon, it is seen in ulcerative colitis. Then a string sign of canter, that is a narrowed ileum and a gobblestone appearance. It is found in a Crohn's disease. String sign of canter, that is a narrowed ileum and the gobblestone appearance. It is found in yes, already we discussed. Okay, then a chain of lake appearance in the endoscopic retrograde cholangiopancreatitis. It is seen in chronic pancreatitis. Then a Mercedes-Benz sign or crow feet sign, it is seen in gallstones. Claw sign and a pincer sign, it is seen in intussusception. Soap bubble sign is seen in a meconium ileus. Central dot sign, it is seen in a Caroline disease. Rat tail appearance of the esophagus, it is seen in esophageal carcinoma. Corkscrew appearance is seen in a diffuse esophageal spasm. Rim sign on a nephrogram, it is used in hydronephrosis. Then fish mouth vertebra, it is seen in sickle cell anemia. And codfish vertebra, it is seen in osteomalacia and osteoporosis. Rugger jersey spine, it is found in hyperparathyroidism. Then bamboo spine, it is seen in ankylosing spondylitis. Pepper pot skull, it is also found in hyperparathyroidism. Then hair on end or crooked appearance, it is seen in thalassemia major. Then beheaded Scotty dog sign, it is seen in spondylolisthesis. Gestational sac can be visualized as early as 4 to 5 weeks of gestation. The yolk sac, it is found at about 5 weeks of gestation. Then crone rump length, that is CRL, it is the most accurate method to measure the gestational age at the first trimester. Then in second and third trimester, we used to measure a femur length and biparietal diameter. To measure the gestational age. In the third trimester, we usually use abdominal circumference and the head circumference. Okay, usually the anomaly scan, it is done in 18 to 22 weeks of gestation. Then a storm appearance or a bunch of grape appearance on a pelvic ultrasound, it is seen in a height-deformed mole. Okay, so what are the most radio resistant tumor? It is osteosarcoma. Most radio sensitive tumor are lymphoma, seminoma, Ewing sarcoma, and dysgerminoma. Okay, with this we will finish. Thank you guys. Have a very nice time.